Hello, I'm Adrian. I'm a dentist with a special interest in endodontics. That's the science and art of root canal treatment. I would like to address some concerns that some people have regarding root canal treatment. People worry about the presence of infection within their body, and so they should. Root canal treated teeth are not dead teeth. The tooth consists of three major structures. Firstly, the hard tissue, the enamel and dentine. That's the bit you see on the top and the bit that forms the root. Inside that we have the pulp. That's the problem area. That's the bit where the nerves lie. That's the bit that has the blood supply, and that's where the infection sets up that causes to need a root canal treatment. But on the outside of the root is an organ called the periodontal membrane or periodontal ligament. If the periodontal ligament becomes infected and is lost through periodontal disease, so really bad gum disease, or through infection from within the tooth, then the tooth will be shed. Your body will not tolerate infection. So root canal treatment is aimed at maintaining the health of the periodontal ligament, the periodontal membrane. How we do this, we remove the infected dead tissue from inside the tooth. Also, the dead tissue is actually not the cause of the problem. Sterile dead nerve tissue does not cause infection. Bacteria invading that cause infection. So if we get in and do root canal treatment, we take away all that nerve tissue and all the old blood vessels, all the broken down tissue and all the infection, sterilise that part of the inside of the tooth, then seal that up so the bacteria can't penetrate it again. The periodontal membrane remains intact, it stays alive, and the tooth's retained. Your body doesn't recognise any problem with it. Where the body does recognise a problem is if it's inadequately cleaned out. If there are bacteria that persist within the root system, then they will leak out, they will cause a localised inflammatory response, and that's what we know as an abscess or a chronic periapical area. The body wants to get in to kill that infection. It can't. The white blood cells can't penetrate, so they stay around the tooth. You see bone loss on x-ray around that tooth, typically at the end of the root, and that's caused by the leakage of toxins from within the tooth into the area. They trigger an immune response which your body deals with. Several people have claimed that dead teeth can cause various ailments by releasing bacteria. Firstly, there's no evidence that can support that. There's no scientifically valid evidence to support that. Secondly, bacteria leak into our bodies all day, every day. The most common route for bacteria to enter our bodies is at our gums. As we floss our teeth, brush our teeth, and even as we chew, bacteria are pushed down the tiny crevice between our gums and our root. And when they get pushed in there, some of them enter our bloodstream. After a meal or after toothbrushing, studies have shown levels of bacteria to be elevated in the bloodstream around the jaws. But we've got white blood cells, that's what they're for. The bloodstream is a hostile environment for bugs. Bugs don't last, so when they're into the blood, then when they enter the bloodstream, they're mopped up by white blood cells. A tooth that has been root canal filled, even if it's inadequately done, has a finite resource of bacteria within it.